the people in this community, the leadership. It's been wonderful. So I'm super happy to be a part of it. In my role, I help oversee the marketing program here. I also oversee the foundation department, and we just started up our volunteer program, which I'm going to talk about a little bit more towards the end. And I also help with patient experience. So always looking for feedback on how we can do things better and what's working well for everybody. So that's pretty much my role here, and I'm here today to introduce you to our Cancer Center project and our team that is working on that, our amazing team of experts that will be here to talk about their role in what you see behind me. That will be opening in July of 2025. So I'm going to hand it off to Medley, who's going to talk about our partnership.
Hi everybody, my name is Medley Shamp. I recognize some of you. Can you hear me in the back? How close that should get. My name is Medley Shamp. I am the Chief Ambulatory Officer here at Astera Health. That means I'm the clinic administrator. I've been here for over 20 years. I've spent a lot of capacity in that time as a nurse, about 10 years in orthopedics. I recognize quite a few of you from that. And then got into the leadership track several years ago and have started working my way in that area. So we're excited for you to come here today. I'm going to talk to you a little bit about the clinic in a little bit, but first, why CentraCare? We're going to talk a little bit about that. CentraCare has been a great partner to us for many years. We've been involved with them for over 20 in different capacities. So cardiology, the cardiologists have been coming up every week for over 20 years. We have about, I think, 6 or 8 of them that visit us on a routine schedule. Then we have neurology, Dr. Kathleen Rickey and her PA Jolene come along. They've been here for over 10 years. Dr. Pat Kern, our rheumatologist, has been here the last 3. And then more recent to us is Dr. Don Jurgens from the Cancer Center from Oncology. So we've had a great partnership with them for many years. They're interested in helping keep our care close to home, and they bring a lot of expertise to us that we don't today have here. They're going to provide us with top-notch best practice, how to treat our patients, what's the latest and greatest treatment regimens, and then they're also going to provide us with some of that physician time that we're going to need once we get that cancer center open. So just a little bit about why CentraCare, like I said, they've been a great partner to us, been providing us great care for many years. So that's why we wanted to choose them as our partner for this.
All right. So behind me are some renderings that the team is going to be talking about what the center is going to look like, and I forgot I'm not in the right spot. Sorry, Mike. So we're going to start off with the floor plan and what is all going to be a part of this. It's much bigger than what some people I think realize is going to be available to our cancer center patients here. So I'm going to start off with Tom P., who's going to talk about our operations side of it. Tom, please take it away.
Good afternoon, everyone. I'm Tom Hint. I'm the Chief Nursing Officer here at Astera Health. Been here for 6.5 years or so. Really excited about this project. You can see from the floor plan here, we're going to be bringing in some additional services that we don't currently have today, as well as some that we've already had. For example, our chemotherapy or our infusion space that's in the hospital. We're going to be expanding that into the new facility, as well as bringing in radiation therapy, PET scanning, as well as just more kind of a more spacious, healing, caring environment. So our infusion space that we're going to be building will have 8 infusion rooms. There'll be actually 6 bays and 2 private rooms that have solid doors just for patients that might need a little more privacy or a little more ill when they come in. One of those will have a bed instead of an infusion chair. The radiation therapy is a new service that we'll be offering here. So we'll have that expertise from CentraCare, bringing in providers and staff to help staff that department. And currently, when a patient needs radiation therapy, they're traveling up to an hour to an hour and a half to find a location that actually has radiation therapy services or a linear accelerator. We'll be able to offer that now in our own community, so our patients that when they're not feeling well and they're feeling sick and feeling fatigued, they won't have to drive that hour there and back every day. Because some of those treatments are daily, Monday through Friday, and can last several weeks. So being able to offer that within our community and keeping our patients here and comfortable is really a priority for us and something that we're really excited about. Some of the renderings that you saw for patients that are coming in, it's entering through the waiting reception area. They're coming in for radiation therapy. There's a little subwait station here for seating for patients because those treatments really don't take very long. They can take 15, 20 minutes and then the patient's ready to go home. So being at the subway, being brought back to where the linear accelerator is, and then they can exit the building afterwards. For patients coming in for the infusion or exams that are the exam rooms that Medley will talk about, they're entering and waiting in this front area here in the main waiting room, and then being brought back into the infusion spaces or into the exam rooms. You can see from the rendering, the second one here, that's just a kind of look at what those infusion bays will look like. Very nice healing environment, big open windows that look out to the west side of the building into the woods over there. So we have some natural light coming into our infusion space today, but this will allow us to have actual, visual look outside into the trees, and especially in the spring here where it's nice and beautiful. Big open windows, big TVs. We'll also be bringing in the Care channel, which has been a popular channel for some of our patients, being able to just watch visual images and calming music on the TV. So a nice private space, open kind of floor plan, so we're really excited about that. In addition, we'll be bringing in PET scanning. So in the last 2 months, we've had a mobile truck coming to provide PET scanning services to our patients. Again, that's a service where we've had to send patients, unfortunately, maybe an hour away to get a PET scan. And that really helps them, the provider determine where the cancer is, as well as the effectiveness of the treatment that they're providing. So being able to offer that on-site will be important. Once, like I said, we have the mobile truck coming in once a month now, but once we open the cancer center, we'll have that right in the cancer center, and patients will be able to come in and be seen right in there and have that imaging done. So a lot of new technology, a lot of new services coming with our cancer center. I will turn it over to Medley to talk about the clinic exams.
All right, so as Tom mentioned, the clinic exam space is going to be in the middle. It's going to look very similar to what you see today. If you've been into the doctor or to see a provider today, those nice big spacious rooms, you have a hallway that you walk down when you enter in, and the provider and nurse leave and enter through that other second door. That's where their workspace is, kind of behind the scenes. We're going to model that exact same thing for the cancer center. So our clinic will be right in the middle of that expansion building that we're planning. Today we have 3 exam rooms that are shared between Dr. Juergens and Cassandra Opatz, who's the current nurse practitioner who visits us. In the future, we're going to have 6 exam rooms. So this will be able to accommodate what I'll talk about next, how much time will providers be in the building. So we have room for growth, and we added some additional spaces that as we grow even more, we need more than 6 exam rooms. We'll be able to expand to, I think it's 8 or 9 more, 8 or 9 total. In a very short amount of time. So we'll use them for something else in the beginning, but then we'll be able to expand really quickly as our program grows. So I'm going to talk to you a little bit about the providers and the folks who will be in that space. So when we build this building, which they're working on outside already, this space will be just for patients receiving cancer care. So you won't be coming over here for your Medicare wellness or to see orthopedics or to see the neurologist. You'll be just coming into the space if you're a cancer patient. In this space, we'll have some registration staff up front, just like you have today. They'll check you in, make sure you have everything, you have your insurance information is correct. And then the folks who are going to provide the care to you, the nursing staff, are going to be a lot of the same people that you see today. Those talented ladies in the infusion department will be coming over to that new space, and they'll be the ones providing our care over there, if they so choose. And then same in our clinic. And then you probably all met April if you've been one of our oncology patients. April's going to continue her same role. She just gets to work in that new space instead of in the main clinic that we have her today. In addition to that, we're going to bring on some new providers. One that's not so new to us is Jamie Udi. She's in the back. If you haven't met Jamie, she's been a nurse practitioner with us for the last 10 years, and she's been in family practice, working alongside Dr. Schmidt and her team. Some of you may have seen Jamie in that capacity. She was chosen to be, applied for and chose to be our oncology nurse practitioner for when we open our new building next summer. She'll be in that clinic every day, 4 days a week in there. Today, she's working on a split relationship, so she's doing a day a week in clinic, in the oncology clinic, and then the rest of her time in family practice. We're in a growth period right now. We're planning that as Jamie's practice grows and Dr. Jurgen's practice grows, we'll start to grow the amount of days a week that they're here and days per month that they're here. So today, Dr. Jurgens is here 2, sometimes 3 times a month. You heard me mention Cassandra Opatz. She goes by Cass. She'll be kind of phasing out as Jamie's finished her orientation and has her own schedule now and has been pretty busy. We opened her schedule wide open now. She's ready to see all the patients. And Cassandra, if you've met her, she's a sweetheart, but she'll be our backup in case Jamie needs some time off. So she'll still be hanging around with us. Dr. Jurgens, I mentioned, he's here 2 to 3 times a month, and we'll expand that as we get ready to open to likely a day a week, a full day a week. And then as we need to expand him, he'll just grow the practice more and more. So we'll start out with what our needs are and be able to have a lot of growth into the future. And then on top of that, we have what Tom mentioned was radiation therapy. We have physicians that's what they specialize in, and they're called radiation oncologists. And they will be here 2 days a week. And then they'll offer some off-site, or you hear the term remote work, where he can log in, he or she can log in from other locations and do some of their work. But they'll be seeing patients 2 a week in that clinic as well. So at the start, we'll probably have, if you think of it in terms of 5 days a week clinic, it's about 6 to 7 days a week of providers in there. So 6 or 7 clinics a week, if that makes sense. We'll also have our LPN staff. Not going to name yet who that individual is, but our nursing staff will follow us over as well. And then same with the folks over in the PET, CT, and radiation. Those folks might be new to us more than likely. We don't offer radiation therapy today, so that'll be new hires into us. Astera Health will be the majority employer of all of those people. It's the physicians that CentraCare will supply us with. So we're bringing some new jobs to Wadena that we didn't have before. That's really exciting for us. Get us on the mark. A lot of people don't know that we have, great services if they're not from this area, and we're currently recruiting some people to come to this area to work because of the Cancer Center. So that's pretty exciting for us. That's, I think, all I have on providers. Provider team. Tom Olson is next.
Hello everybody, I'm Tom Olson. I am the Director of Administrative Services here at Astera. I've been with the organization off and on for about 6 years, I like to tell people. I took a little break. But I've come back, and one of the reasons I came back was for what you see in front of you. I'm absolutely passionate about a cancer center. So they have blessed me with the opportunity to project manage this. So luckily I'm surrounded by a bunch of really smart people because I don't know a lot about clinical or care. It's been a blessing to be with this group of people and others who have helped guide me along the way. Joel had asked me not too long ago to kind of reconstruct the calendar of when we started working on this and what the major events were that happened along the way. I had to go back almost 3 years. This has been in conversation for 3 years with this organization and CentraCare as well. So that feels like a long time, but suddenly we're here. If you were outside this morning or drove by recently, the last few days, dirt is moving. We're actually on track right now. We partner with Mortensen, who also happened to build this facility for us as our general contractor. A lot of the same subcontractors are helping. Not all the same, but quite a few of them are very familiar with this facility and the intricacies of what it takes to connect all that up, because there'll be connections between them as well. So we did break ground this last week. What you'll start seeing first is you'll see a big mess out front. That's going to be the patient parking lot. Right now, Mortensen's going to be using that for staging as they work on the outside of the building. They're making a mess out in back right now. We're trying to expand our parking lot a little bit back there. That should be done in the next week or two. We're paving some things out there. The other thing you'll see if you're familiar with the area is we started to really utilize our remote parking, which is over to the northeast of the building here. We're going to get chased out of some of our employee parking in the back, so folks are going to get a little bit of a walk for the next few months as they come into work. And then hopefully by next spring we'll have them back in there. But for right now, this next few weeks we're going to be churning up the ground, and then we'll be starting to lay down the footings. We expect by mid-July all those footings will be in, and they'll be starting to prop up steel and walls and roofing and things like that. And by October, roughly, we should be ready to start working on the inside of the building, which seems incredible. It goes fast, right? Tom and Medley kind of pointed out some key points from the building. One that I want to point out that I think was very insightful of our group is this notch that's missing up here in the corner. That is already designed for expansion. So we won't be those people who later say, gee, I wish I woulda. We know exactly what we want to do when we get that opportunity to expand. So a real blessing for us, I think, for the long term and for the vision to be able to grow this program and add those infusion bays and have those clinic rooms that we might need going down the line. So excited about that. So with that building up from October through about December, early January, they'll be working on the inside. Lots of stuff to do in there, getting all the rooms and infusion bays and waiting rooms all ready to go. Around March, April of next year, they're going to deliver the linear accelerator into the vault. This is a huge vault, really thick cement walls. We can't get this wrong. These walls are a foot thick of cement, so not something you want to go back on later and go, we missed that pipe. So working really hard on that. That'll be delivered next spring. The PET CT imaging equipment Tom talked about will be delivered next spring as well. And so by April, May of next year, we'll have that stuff in, and we're going to be starting to do our testing and getting everything configured and lined up that way. And we expect to have first patient in by next July. So super excited. 15,350 square feet. This will be when it's done. So I think everybody will find it very nice size. We visited some cancer centers around Minnesota. Centricare was gracious enough to let us walk through some cancer centers that they work with today, and I think we're going to have the best one, frankly. I think it's pretty sharp, so excited you're all here today.
So first off, we have our volunteer program, which we just resurrected in May, with the amazing work of Kim Weiswinger, who has worked her tail off to get that thing started back up. There will be volunteers needed in the cancer center. If you'd like to get your boots on the ground and ready today, we do have a volunteer sign up on our website that we would love to have you participate in that amazing program and make connections with people who have the same interests as you. And then we also have the different levels of support that you can financially give. If you don't have time to give because you're busy with the grandkids or travel, I understand completely. But maybe you'd like to join our Gemini Circle. For $25 every 3 months, you join our Gemini Circle for a grand total of $100 a year to help support the operations of our cancer center, which will be very needed as this cancer center opens to be able to support the program and help us be sustainable in our efforts. So please take that with you. Feel free to share it with whomever. And if you have any other questions, by all means, please ask now. We've got all of these amazing people who would love to answer those. So any other questions before we wrap up?
We made our announcement last July. 3-4 months later, competing organization to the east, Lakewood, made an announcement that's very similar. And the question I've been asked is, well, what's different? Are you doing something different than they are? And the answer to that is yes and no. So I'll start with no first. They will end up with a center that is very similar to ours from a building and technology perspective. In fact, we know that the machinery in that PET CT imaging room is identical because we're buying them through the same vendor, and we know that. And it's a co-op that we're part of. They are essentially identical pieces of equipment. To do what they're going to do, they need all the same stuff we do, same type of people and so forth. So in the end, not really different, but the big differentiator is our relationship with Centricare. And part of that is they will bring to us all of their, I don't know how long they've been doing cancer services. I'm sure it's like 50 years, long time. We get the advantage of everything that they already know. All the mistakes they've made, all the successes they've had, dozens and hundreds of people with great expertise. I'm going to point to Jamie in the back of the room. She's been trained on this. Who trained Jamie? Besides doing a lot of her own reading and studying, it was Centricare. Jamie spent essentially full-time for about 6 weeks, traveling every day down to St. Cloud to be trained by the people that she'll be working with here and many of her will now be peers. that's something that just can't be duplicated. If we had to figure that on our own, that would have taken a great deal more time and been certainly less efficient and probably less effective, in our opinion. CentraCare will bring all of the providers that Medley talked about. They also bring all of their policies, procedures, techniques. Again, we get to know everything that they know, and we get to hit the ground running at 100 miles an hour, full speed. So that is the big differentiator that we see in terms of looking to the future.